My name is Mary Wallner. I've been here for 50 years. I'm an administrative assistant for regulatory compliance. It was an inpatient facility. We treated only military and their families. We had all hospital facilities. We had cardiac care. We had inpatient peds. It was open 24/7, and now it's just an outpatient facility with sites all over the state. Mainly because everybody has been so wonderful. There's been many times when I could have been let go. I was a transcriptionist in radiology from 1967 to 2005, and there was many slow times. But they've always seemed to find a way to keep me here, and I think that that's wonderful. And in my generation, that's what you did. You came to a place, you found it, you liked it, and you wanted to retire from there. You didn't always think the grass was greener somewhere else. I know I've had a wonderful time here. I always said that I would I came with the building, and I'm leaving with the building, and I actually am, because we're moving.
M. Jones, and I work in linen or general services, and I also say 50 years this year.
Congratulations.
Comparing to then, the changes is better, really, compared to when I was here back in the day. Let me tell you about Hospital. You know, Hospital was a clinic on the first floor. That went back, a regular ward on the first floor of Halsted. And then with the OR, I used to work up there, off and on, bringing linen up there. And like those old movies, I call Frankenstein movies, you see the doctors and their whites, they had a gallery. I could picture that right now to see how the interns and different ones are watching different surgery. Just like you see in the movies, with the gallery, the doctors looking with their notes. It's just amazing just to see the changes that is rapid, is happening.
I know that we are providing quality health care for patients. And in the last 8 to 10 years, we've expanded, and that has been very beneficial to the area that we are in. Hopkins has given a lot for me, and I've given a lot to them. So I've enjoyed it. I really have.
Good.
I've enjoyed it.
Thank you so much.
You're welcome.
My name's Teresa Ford. I started work at Hopkins in October of 1967. I came here for my first job was in the cashier's office.
Okay.
And at the time, Ron Peterson was interviewing people for that job. So I got to interview with him.
Oh, that's wonderful.
Yeah. Well, when I started here, you had to come dressed up in a suit or a dress, no pantsuit, no slacks, no sweater, and that has been the big change of everything. You more or less had to come dressed like if you were going out to dinner or something. That's how we used to have to dress when I first started here. I had the cashier's office, and from there I went to billings, where I helped send out these statements for people to pay their bill. And then I came up here, so I've only really had like 3 jobs. I am considered a project analyst. I scan our drawings, the as-built drawings when they finish a job, and also the contracts that we need to keep on file. That's what I do right now. It's a truly an honor to hear work at Hopkins.
It started a long time ago. Long time ago. Can you imagine there was Sinai across the street, St. Joseph on Caroline Street, Church Home, City. I mean, it was like everybody's right around this walk area. But now they're all gone.
There were
all these years, the most memorable moment was working in rehab. We saw a stiff man who couldn't even talk. And you would go in the room and every day you would say something like, hello, how are you? And then this one day, he answers. So what do you think you do? You lose your heartbeat and you think, how did you do that? And he's laughing at you because he just finally figured out he can talk. You get to meet 1 million people. Do you know how many people I meet per year? And honestly, most of them remember your name when they come back, and it's like, how do you do that? I can't remember their name because I see so many. And it's like, I don't know, every day is different because I work with the patients who are doing surgery, and it's easy to stay here.
Her name is Ruth Naomi Lepard. When I first stepped into Johns Hopkins Hospital, it was not my intentions to do this. I came for an interview on a Friday. When I got home, my mom said, you go to work on Monday. And I said, what? So this is what I did. When I started, I was a clerk. And I was excited. When we went through the hallway, we hit on heels. But time has gone on, and I wear flat shoes now. What I like about the hospital, we work as a family, and we all work together. The doctors here were like family to us. They knew us by name. They respected us. When I was going through, I had cancer. Dr. Jacobs, she was one of the most beautiful doctors. She treated me as if she knew me. When I had my operation, before they operated, we had prayer. As soon as I said amen, they knocked me out.
You beat cancer.
Oh yes, but you know what? I still go to Dr. Jacobs.
My name is Isabella Shanks, and I work in the Johns Hopkins Nutrition Department. 2017 was 51 years.
I have, in my 53 years, I have learned a great deal. But I have worked my way from being a clerk to an analyst, a secretary, and a supervisor. And it has been a pleasure of being here my 53 years.
My actual anniversary date is 9/11, and this year gives me 50 years. Times were a little different then. I remember starting off at $1.54 an hour, and after a month or so, the general superintendent is what they were called now. Now he's the senior director. But Mr. Johnson called me in his office and said that he heard I was doing a very good job, and he gave me a raise, 8 cents an hour. Times have changed. Probably 35 years ago, I was the supervisor in the carpenter shop. And Jerry Ann Wilson, who was the director for Child Life, came to my office and she said, we have a situation, I need your help. There was a little girl that was in the oncology building, and she was so sick that she couldn't raise her head, but she loved to draw. and Jerry Ann asked me what we could do to help this child out. Well, I went and I got some measurements and things, and I took an overbed table and cut it up, just cut it apart. Took it down to the welding shop, had it re-welded. I put a little clip on the top, put a little tray on the bottom so her pencils would sit there, and the overbed table would go to her. When I delivered it to the floor, the child's mother, I mean, she cried and she hugged me and she couldn't thank me enough, and she wanted to know how much it cost. And I told her, I said, I think this is the least Hopkins can do. Well, I went back a few weeks later and she had passed. This is the rewarding things that you can do at Hopkins. Everyone I hire at Hopkins, the very first thing that I give them is my little speech about no matter what you do at Johns Hopkins Hospital, whether you're sweeping the floors or cleaning the grounds or preparing the food, everything has an impact on these patients, and we're all here for patient care. It's probably why I stayed for 50 years, because it's very rewarding.